Hey there, folks. Let's talk about something really important today. It's all about healthcare for our lovely seniors. You know, those amazing people who've been around the block a few times? They deserve the best care, don't you think? As we get older, our bodies start to do funny things. Sometimes they don't work quite like they used to. That's why good healthcare becomes super important. It's like giving your car a tune-up, but for your body. And let's face it, our seniors have earned some TLC. Now, I know what you're thinking. Ellen, healthcare can be so expensive. And you're right, it can cost an arm and a leg. But here's the good news. There's a program that helps our seniors get the care they need without breaking the bank. It's called Medicare. Medicare is like a superhero for seniors. It swoops in to help with medical costs when they need it most. And trust me, it's a big deal. So let's dive in and learn all about this fantastic program. Are you ready? Let's go. All right, let's start with the basics. What exactly is Medicare? Well, it's a health insurance program run by the government. It's designed specifically for older Americans. Think of it as a big safety net for healthcare costs. Pretty neat, right? Now, who gets to use this awesome program? Generally, Medicare is for people who are 65 or older, but here's a little secret. Some younger folks can get it too. If you have certain disabilities or conditions like kidney failure, you might qualify even if you're not 65 yet. Here's another cool thing about Medicare. It doesn't care how much money you have. Rich or poor, if you're 65 or older and a US citizen or permanent resident, you're in. It's like a big healthcare party and everyone's invited. But wait, there's more. Medicare isn't just for doctor visits. It can help with hospital stays, prescription drugs, and even some preventive care. It's like a Swiss Army knife for healthcare. It's got a tool for almost everything. Okay, now let's talk about the different parts of Medicare. It's like an alphabet soup, but don't worry, I'll break it down for you. There's Part A, Part B, Part C, and Part D. C, easy as A, B, C, D. Let's start with Part A. This is the part that helps with hospital stays. If you need to spend a night or more in the hospital, Part A has got your back. It also covers things like skilled nursing care and some home health care. Think of it as your sleepover insurance. Next up is Part B. This is for your regular doctor visits, preventive care, and medical supplies. Need a flu shot? Part B. Want to get your eyes checked? Part B again. It's like your day-to-day healthcare buddy. Now, Part C is a bit different. It's also called Medicare Advantage. It's like getting Parts A and B, but from a private insurance company. Sometimes it includes extra perks like dental or vision coverage. It's Medicare with a cherry on top. Section 4. Enrolling in Medicare, your step-by-step guide. Let's talk about how to get Medicare. It's not as complicated as assembling IKEA furniture. For many people, it's super easy. If you're already getting Social Security benefits, you'll be automatically enrolled at 65. It's like magic. Poof, you're covered. You'll get your card about 3 months before your birthday. Not getting Social Security yet? No problem. Sign up online at the Social Security website. It's as easy as ordering a pizza online. Remember, there's a specific time to sign up called the initial enrollment period. It starts 3 months before your 65th birthday and ends 3 months after. Section 5. Medicare's benefits, a safety net for seniors. Now let's talk about why Medicare is such a big deal for seniors. It's like a superhero cape that protects you from high healthcare costs. And let me tell you, those costs can be scarier than a horror movie marathon. First off, Medicare helps cover a whole bunch of important health services. Need to see a doctor? Medicare's got you. Need a flu shot or other preventive care? Yep, Medicare helps with that too. It's like having a health-conscious friend who's always looking out for you. But wait, there's more. Medicare can also help with the cost of prescription drugs. We all know those can be more expensive than a fancy dinner date. With Medicare Part D, you can get help paying for your medications. It's like having a coupon for your pills. And here's something really cool. Medicare can help you stay healthy, not just treat you when you're sick. It covers things like wellness visits and screenings. It's like having a personal health cheerleader. Go you! Section 6. Navigating Medicare's challenges. Okay, folks, I've been singing Medicare's praises, but let's keep it real. Like anything in life, it's not always perfect. There can be some bumps in the road, but don't worry, I'll help you navigate them. First up, Medicare doesn't cover everything. Things like long-term care, most dental care, eye exams for glasses, and hearing aids aren't covered. It's like a restaurant menu. Some things just aren't on it. But don't panic. There are other ways to get help with these costs. Another challenge can be understanding all the different parts and options. It can feel like trying to solve a puzzle sometimes, but remember, there are lots of resources to help you. You can talk to a Medicare counselor, use the Medicare website, or even ask for help at your local senior center. Sometimes you might have to pay some costs out of pocket. These can include deductibles, co-payments, or co-insurance. It's like when you go to a restaurant, even if you have a coupon, you still have to tip. But overall, Medicare can save you a lot of money on healthcare.